Welcome to the ADAA webinar on school accommodations for kids suffering from anxiety. I am Jean Tycro, the Director of Communications for ADAA, and I'm the staff liaison to the Public Education Committee, which is the producer of this series of free monthly webinars. Before we begin, I'd just like to tell you a few things. If you haven't been to one of our webinars before, that we will have a time for questions, and that's at the end. Oh, excuse me, I jumped the gun. And the way you can ask a question is there's a little pod, Q&A, a little section, and you can type your question in the field, and nobody can see it except you and I and our presenter tonight. So you can ask anything, and we'll try to answer them. If we can't get to your questions, I am terribly sorry. We often run out of time, and I apologize. The webinar is also being recorded, and we'll make it available on the ADA website at a later date. I'll send you an email. And also, this is being broadcast, so we can't really help you with any of your individual audio or visual computer settings. And right now, I'd like to introduce you to Dr. Jenny Yip, who is right here. And she is also a member of our Public Education Committee, and we're very happy about that. And she's the Executive Director of the Renewed Freedom Center for Rapid Anxiety Relief, that's in Los Angeles, California. She's a clinical assistant professor of psychiatry at the University of Southern California Keck School of Medicine. And Dr. Yip will address the academic challenges a child with anxiety faces and the key aspects of obtaining school accommodations so your child can get the tools he or she needs in treatment to manage anxiety successfully. And before we start, let me just give you a few words about ADAA. It was started in 1979 as the Phobia Society, but today it's the leading nonprofit dedicated to increasing awareness and education about anxiety disorders, depression, OCD, PTSD, and related disorders. And we'd like you to visit the ADA website if you haven't already. That's www.adaa.org, which includes the very helpful searchable database called Find a Therapist. And we have lots of educational information and resources, self-tests, self-help groups, clinical trials, and a whole lot more. And we also very much appreciate any support you can give us in the way of a charitable contribution. And you can do that directly on the ADA website as well. Now, let me turn this over to Dr. Yip. Welcome, Jenny.
Thank you, Jean. So what I like to do today is I want to first describe what anxiety is like, what a child suffering from anxiety goes through on a day-to-day basis. Once I do that, then we'll be able to discuss how school can be interfered, how anxiety interferes with school and academic functioning, and then what we can do to support this child so that it is the most conducive to learning for the child. So what I want everyone to do right now is just so that you can understand what a person suffering from anxiety experiences on a day-to-day basis, I want you to think about a loved one. And I want you to imagine that loved one. Spend a couple of seconds picturing them in your mind. Now I want you to imagine that you were supposed to meet them at 6 p.m. tonight. And it's 6 p.m. and they haven't shown. They haven't called, they haven't emailed, they haven't notified you. Now, imagine that it's now 6:30 and they still haven't called. Obviously, by now, hopefully, you would have tried calling them and tried contacting them. However, their phone goes straight to voicemail, and there's no response. You text them, there's no response. You try to IM them, there's no response. And it's now 6:30. And from 0 to 10, where would your anxiety level be? 10 being the most uncomfortable anxiety that you could ever experience, and 0 being absolutely no arousal at all. For most of us, we might be at a, 5 or 6, depending on how dependable this person is. However, let's say now it's 9 p.m., so 3 hours after the time that you were supposed to meet this person, or 3 hours after the time where this person is supposed to come home. And you still haven't heard from this person. This person is nowhere to be found, and now you're really concerned. Now where would your anxiety level be? For most of us, it would probably be at a 10, if not, more than a 10, if it could be more than a 10. Now, I want you to imagine what you would be doing during this time when you're wondering and concerned. Would you be able to sit in front of a TV and watch your favorite show? Would you be able to read a book? Would you be attend to this webinar if you had a loved one who's gone missing for 3 hours? Probably not. Now, what are some of the thoughts that you would be having? You would probably be thinking, what in the world happened to this person? You might be having images of some accident happening, something awful happening to this person. Now, would you just be sitting there twiddling your thumb? Probably not. You'll probably be calling friends, calling relatives. You might be hacking into their email and Facebook and checking to see where in the world they could possibly be. You might even drive around the neighborhood, go on a search. However, I bet most of you would not be sitting still, and you wouldn't be able to attend to something that requires your focus and attention. Okay? So basically, what I described to you, this depiction of a single situation, is what a person suffering from anxiety goes through 24 hours a day, if they were awake 24 hours a day. However, the anxiety that a person experiences is at that heightened level throughout the day. So imagine having to live in that fear-based level. It's quite destructive, to say the least. So what's happening is basically for a person experiencing anxiety, worry, concerns, fear, this is the cycle that the person experiences. There is always a feared trigger. The trigger can be a thought about what's happening, impending doom, catastrophic consequences. It could be a specific situation, being in an unknown, unfamiliar place, anticipating uncertainty. It could even be certain sensations. Let's say, your heart is palpitating, or you're feeling like you're hyperventilating, you can't breathe, you're choking, you're feeling dizzy. Now, any of these feared trigger typically will induce discomfort. Naturally, it would induce discomfort, right? Anytime that we experience a fear, have a negative thought, have a negative consequence, we're going to experience discomfort. And what most of us do when we're experiencing discomfort, because we do live in a society where we can't tolerate discomfort, is that we engage in escape behavior or avoidance. Some of us may use distractions, such as I'm just going to be watching TV and distracting myself from the worrisome thought, or I might go out and do something. I might go to the gym and work out and focus my attention elsewhere. I might even do something called seeking reassurance, and this is when people have a need to know. So any uncertainty would induce them to ask questions over and over and over again. Now, anytime you engage in such escape behavior, you might experience the slightest relief during the process. However, what happens is that the relief is never long-term. The relief is always temporary. And what happens is that the fear will always come back. And before you know it, you're going through this cycle again. And the more you engage in the avoidance behavior, the more you're actually reinforcing this vicious cycle of anxiety. So anxiety is related to the fight-or-flight response. And for some of you who have forgotten what the fight-or-flight response is, you've all learned it in a biology class. The classical example is right in front of you is a saber-toothed tiger. Now imagine your body being a well-made machine equipped for survival. And in order for you to survive this saber-tooth, certain mechanisms in your body have to be activated in order to get you to run or fight, hence the fight or flight response. In order for you to run or fight, for example, your heart rate increases. And the reason why your heart rate increases is because the heart is kind of like your body's motor. And if we're going to be using a lot of energy, that motor needs to be activated quickly. So the purpose of the heart is to pump blood throughout your system, throughout all of your organs, especially your muscles and your brain. Without energy in your muscles would be paralyzed, and therefore you wouldn't be able to run or fight. However, you're also breathing heavily, and you're breathing heavily because you're bringing in oxygen into your bloodstream, into your body. And oxygen is your body's natural fuel. Without oxygen, your body, your organs, your brain, your muscles will cease to exist. So you're bringing in oxygen through heavy breathing. Your heart is pumping faster to generate the blood throughout your system. And because the heart is pumping so fast, your body's producing a lot of heat. Heat has to come out in some form, otherwise your body will combust, and we wouldn't want that. So in the human body, heat comes out in the form of sweat. So you're sweating because you're producing a lot of heat, and you're cooling off your system through sweating. Now, another factor that occurs when your fight or flight trigger occurs is that your cognitive functioning goes down, because you really don't have the capacity to contemplate, should I fight or should I run? What are the chances if I run that way versus the other way? What are the chances of survival if I use this weapon to fight versus that? In a true life-threatening situation, you have no time to contemplate, and therefore your system requires you to rely on your intuition, and therefore your cognitive functioning goes down. You don't have the ability for reasoning, logical reasoning. Another thing that happens is that your GI tract, your gastrointestinal tract, shuts down. And this allows your body to use energy in your larger muscles rather than in the core. And because your core is shut down, a lot of people experience nausea, diarrhea, headaches, stomach difficulties, and this is usually because your GI tract has shut down. Now, all of these functions occur so that your body can be the well-made machine equipped for survival, okay? Now, what if, rather than seeing the saber-toothed tiger, you see this cute, cuddly kitty cat? Would your fight or flight response be initiated? Absolutely not. The important factor here is that you are the one to perceive danger. Your body's automatic fight or flight response does not have any filter to determine whether the threat is a real threat or a false alarm. It simply responds to whatever it is that you perceive. So if you are perceiving impending doom, even though if doom is not realistic or is far away, your brain cannot tell the difference, so it will simply respond with the fight or flight trigger. However, if it is a real danger, then and you perceive this cute cuddly kitty cat, then unfortunately you be lunch because your fight-or-flight response would not be activated. Again, the important point is you're the one in control of what you perceive. So how you perceive your environment depends on you, and whatever it is that you perceive will determine your experience, your physiological experience. So there are two components of anxiety. There is your objective physiological sensation, such as the nausea, the sweating, the heart palpitation, the resulting headaches, the difficulty breathing, the choking sensations. And then there is the subjective experience or the emotions that you experience. These are the adjectives that people report, that I'm worried, I'm scared, I'm nervous. This is the subjective experience. And it's important to distinguish between the two because just because your body is reacting to the fight or flight response does not necessarily mean that it's unhealthy. So it's really important to determine what is a real threat and a false alarm. Anxiety and chronic anxiety is when you're consistently interpreting a false alarm as a real threat. However, there will be situations where it's important for you to be able to, for your fight or flight response to be activated because in the face of real danger, you're going to need that to survive. So what I want to do right now is I want to give you another metaphor to really bring home the difference between your subjective experience and your body's physiological objective response. So let's take the experience of skydiving. I don't know how many of you have gone skydiving. However, it can be either a very exciting experience or a very frightening experience, depending on who you are. If you take two people, and let's say person A, they're both up in the plane, they're about to jump, and person A is experiencing the fears, the heart palpitation, the heavy breathing, the shaky limbs, and this person is thinking, oh my gosh, I can't believe we're up here. If we ever survive this, I'm going to kill you, okay? So this person is experiencing fear. Now let's take the next person, person B. This person is experiencing the same physiological response. The heart is palpitating, the person is breathing heavily, the limbs are shaky, the person might be sweaty, a little bit jittery. However, person B is thinking, oh my gosh, this is going to be so fun, I can't wait to jump out of the plane. So what is the difference between these two persons? The only difference is basically how they're perceiving the experience, which is the subjective experience. Nothing is really different between their body's objective response. They're feeling exactly the same thing because in reality, skydiving can be a threatening situation. However, it's how you're perceiving the situation. If you're perceiving it as impending doom, then you're going to experience the emotion of fear. If you're one of those adrenaline junkies, then you're going to experience this as an exciting situation. And you're not going to experience the anxiety and worry that a person who is anxious experiences. So it's really important to be able to distinguish the two. Now, the person with an anxiety disorder, guess which person they are, usually A or usually B? Well, they are usually the A person. The physiological effects of anxiety can cause a whole host of bodily complaints, as I said previously. And the person A who constantly experiences a chronic level of anxiety is going to have a high level of blood pressure and heart rate. Because their fight or flight experience is always activated, They could be experiencing nausea as a result. They could be vomiting, experiencing stomach pains and ulcers and diarrhea, tingly sensations in their limbs and fingertips, feeling weakness because, again, if you're using all of that energy, the fight-or-flight response requires a lot of energy, you're going to feel weak. Okay, so this is what happens with a person who's constantly experiencing anxiety. So if you have a kid who's constantly complaining about these symptoms, a lot of times it's due to anxiety. Now, unlike popular belief, anxiety is the most common mental, emotional, behavioral problem to occur in children and adolescents. In fact, about 25% of teenagers will experience an anxiety disorder during their adolescence. However, the problem is that it's often overlooked or it's misdiagnosed. Most of the kids who come through our treatment center have been misdiagnosed for several years before they obtain an appropriate diagnosis. And the problem with that is that they get the wrong treatment or they get non-beneficial treatment if they've been given the wrong diagnosis. Now, if we go back to that initial example that I used about you missing a loved one, so imagine a teacher who is observing you, and you can't sit still. You're pacing around. You're getting up, sitting down, pacing around, checking the phone, checking your emails, going on the computer, calling people. What do you think that teacher would assume, or what do you think a professional, a clinician would assume that behavior looks like? At first impression, that behavior may look like ADHD, right? Now, add on the distraction that you would have because you won't be able to attend to the lecture, to the teacher. You wouldn't be able to focus on reading. You wouldn't be able to focus on a discussion. That also adds to the inattention. So the unfortunate thing is that most kids with anxiety disorders, on the first look, they actually look like someone with ADHD. However, the important thing is to look deeper and ask, why are these symptoms occurring? Now, some common anxiety disorders in students include panic disorder, specific phobia, social performance anxiety disorder, obsessive-compulsive disorder, generalized anxiety disorder, and one more that I didn't add in here is separation anxiety disorder. You will usually see separation anxiety disorder and specific phobias in younger children, while all of the other all of the other conditions you'll see in older children. Although we've seen kids as young as 3 years old with full-blown obsessive-compulsive disorder. So there's a wide range of what kids can be presented with at any age. Going back to that initial example again, here are some of the effects anxiety can have on your functioning. It will definitely interrupt your thinking. You will probably have a lot of difficulty making decisions because if your ability for rational thinking is not completely intact, you're going to question your ability to make decisions or make the right decision. If let's say that you have kids in the house, and during this crisis your kids are asking you questions or your kids are trying to get your attention, well, your tolerance will probably be quite low at this point, which will lead to irritability and low frustration, right? And let's say you tell your kids, hold on a second, I'll get to that in a little bit, and they don't listen, and like some kids, they keep badgering you. Well, you might get angry and you might have a meltdown. How would you perceive your environment? Well, the fact that you're already thinking about potential danger and impending doom, you're going to be apprehensive about your environment. You're going to look at your environment with suspicion. And all of these functioning will definitely interfere with learning and concentration. So what do we do for kids with anxiety disorders? Well, the evidence-based treatment for anxiety disorder is cognitive behavior therapy, which is not your typical talk therapy or play therapy. Cognitive behavioral therapy teaches you how to interact with your environment so that it is more reflective of reality rather than the catastrophic thinking that you have. And as your behaviors are adapting to the reality, then your thoughts will eventually change and your feelings will also eventually change. So cognitive behavioral therapy really focuses and targets in on behaviors that usually that eventually changes your thinking patterns. Now, the goal for teachers isn't to do treatment, right? The goal for teachers is to promote learning for the student. We want to leave the treatment to a professional. However, what we want to do also is assist teachers in the schools so that it is the most conducive to the child's functioning, to the child's learning. Some of the things that you can ask a therapist to do is to collaborate with schools. Some therapists will provide outreach or school-in services, and the purpose of this really is to increase awareness of what behavioral manifestations exist for kids with anxiety versus the ones with autism or ADHD. Because even though a lot of them may look very similar, the symptom presentation may look very similar at the outset, if we question the why is this behavior happening, then the answers that you get will determine what conditions we're dealing with. And that is what we need to ensure proper intervention. It's important to communicate with the child, the family, the school, and it's important for the teachers to have regular check-ins with the child. So a lot of times what I ask is for teachers to check in with the family and the child at least once a week. You know, using a notebook, which I know may sound very old school. Teachers today and kids are using the internet. There's this thing called the cloud where teachers communicate with family members, parents. So it's important to have these brief check-ins on a regular basis that facilitate long-term goals. And it's also important for teachers to document behavioral changes in students, both positive and negative, because we only know if something is working. A therapist will only know if something is working if we know why the behavior change is occurring. So we can ask teachers to document behavior changes. When did this behavior occur? What was happening surrounding this behavior when it occurred? What were the consequences when this behavior occurred? This will assist treatment greatly. You want to help teachers establish rapport with students, and it's really important. I don't think this is true just for kids with anxiety disorders. I think this is true for any child. A calm, supportive teacher is going to be a lot more effective than one who's going to be impatient or a little bit more harsh and critical. And in fact, a student who is put in a harsh, critical environment naturally is going to trigger anxiety and stress. And when the student experiences heightened levels of anxiety and stress, naturally you will see behavioral manifestations of anxiety. And let me just first describe what some of the behavioral manifestation of anxiety may look like. It could be anything from a kid tapping his foot to wiggling his thumb, squirming in his seat. These are the physiological components of anxiety. A kid could be asking a lot of questions to reduce the uncertainty that he experiences or reduce the fear of the unknown. A kid could also, for example, a kid with OCD could constantly be leaving the room or asking the teacher to give him hand sanitizer so that he could engage in ritualistic behaviors. The important thing, again, is to understand that if this is a child with anxiety, the behavioral manifestation is usually due to anxiety and not because of insubordinate behaviors. Okay? So always have teachers speak clearly, calmly, in a kind manner. I think that is the main goal. You want teachers to know each student's progress based on the student's own behavior and achievements without comparisons to other classmates. I know a lot of schools are attempting to do this today. Some kids with anxiety have a difficult time making decisions for fear of not making the perfect decision. And when a kid has this difficulty, usually it's due to perfectionism. They fear that they'll be responsible if they make the wrong decision, or making the wrong decision will have catastrophic consequences. When this happens, it would be useful to give the child a set guideline. So, for example, a set timeline of, for example, 5 seconds. So let's say little Johnny, answer this question in 5 seconds. And when we do this with kids, it's really important to be asking close-ended questions rather than open-ended questions. It's much easier to answer yes-no questions or to give the child options of what the answer could be rather than asking abstract, vague, open-ended questions. And as the kid get used to 5 seconds, then you can always tailor it down to 3 seconds, 2 seconds, to eventually when the child does not need to spend a lot of time deliberating over answering questions in the future. If a child is engaging in behavioral manifestations of anxiety in the classroom, it's important to help them postpone the behavior by distracting them if possible. In treatment, this isn't what we do. In treatment, we actually help kids learn to confront their fears. We do not use distraction. However, again, we're not asking teachers to be treatment providers. We're asking teachers to produce the most conducive environment for the child's learning. So if distraction is necessary, then that's what we have to do in the classroom. And then you can address it in treatment if distraction is being used in the classroom. And distraction or postponing the behavior could be anything, such as asking them to talk about something that they're interested in, asking the kid with anxiety to answer other questions that's unrelated to the task at hand, to talk about their weekend or talk about something that they're enjoying. You can also pair them up with a buddy for an assignment, which could take the pressure off of the kid himself. You want to remind the student that their urge to escape the behavior or their anxiety is because of the anxiety monster playing a trick on him or her. And it's not actually their need, for example, if they want to keep leaving the classroom to wash their hands. It's not really their need. It is the anxiety monster playing tricks on their mind. You want to encourage them to step outside and take a break if it's necessary. Think through the situation. Always reframing this situation as the anxiety monster rather than the child's problem. It's the anxiety monster's problem because that takes the pressure off of the child. However, sometimes the anxiety is going to get so high that there's nothing that you can do. And if there's nothing that you can do, just let the student take a break without adding any more pressure. The more pressure you add when the student isn't responding, the more anxious they will become because it gets them, they'll start to feel self-conscious, and that's not what we want. Some students with anxiety seek reassurances, again, to satisfy their need to know, to satisfy their doubt, to know what uncertainty the future holds, and sometimes this can indicate that the child has a perfectionistic need to also get things just right. So they will constantly ask questions, is this right? Is that right? Did I do this right? What was your question again? How do I do this? And when these questions occur, it's really important to respond with ambivalent answers. You don't want to respond with, that's okay, Johnny, everything will be okay, because that's not real, and sometimes that's only lying to the kid, and you don't want to be lying to the kid. It's better off saying, you know what, I'm not sure, Johnny. Why don't you make your best effort at it, and if it doesn't work, then we'll figure out what works. It's much better to respond with ambivalent answers than respond by reassuring the child, because when you reassure the child, it's actually you're giving them the escape. So if we go back to that vicious cycle, you're giving them the escape response. Some kids have severe test anxiety. And it's really important to be able to provide accommodations for kids with severe test anxiety. Some accommodations can include taking breaks during a test. Of course, it's got to be structured, so it's not, taking a break every 2 minutes. If it's a 30-minute quiz, you might want to give the kid a break at 15 minutes, a 5-minute break. You want to be able to provide the test in a non-distracting, quiet location. It's okay to also let kids take the test orally if that helps. Sometimes that might not help if the person has performance anxiety. And giving them extra time. So if the child is working away at the test and, they can't finish everything, it would be okay to give them extra time. Of course, all of this is in a time-limited situation. It's not like we're going to provide these accommodations long-term. The hope is that the child is working with a professional to address the anxiety itself and to give the child tools to address the anxiety so that over time these accommodations can be reduced. One important thing for a child with test anxiety is letting the child write directly in the test booklet. If a child is already feeling a lot of anxiety, trying to transfer answers to from the test to another booklet might create some problems, as you might be able to imagine. They might be answering the wrong question. They might be answering it at the wrong section. So it would be much less anxiety-provoking to allow them to write in the test booklet itself. Again, there are students with perfectionism. These are kids who are afraid of making mistakes, of doing things wrong. And this isn't just a preference. These are kids who can't function if the idea of being imperfect is present. So for such kids, you want to make sure that directions and instructions are readily available, whether it's available right in front of them on a piece of paper or on a whiteboard or somewhere else where they're able to get the information quickly. A lot of the time, kids with perfectionism, they fear not getting the information correctly due to their own distraction, or they might think they have misunderstood the questions or the instructions. So therefore, it's important to make sure that the instructions are readily available. It's also important to be asking direct questions rather than open-ended ones, and we discussed this earlier. And sometimes a kid with perfectionism can take an inordinate amount of time to complete a task. This kid would be checking and rechecking and triple checking, and what would usually take 30 minutes for most kids might take 2 to 3 hours for a kid with perfectionism. So it would be useful to provide this child with time estimates for each assignment. So letting them know, well, I don't want you to spend more than 30 minutes on this, so I want you to go through it as quickly as possible. If you're spending more than 30 minutes, then you're putting too much time into this particular assignment. And the goal is for them to stay within 10% of that time estimate. If the child is having a lot of problems getting work done because they are spending a lot of time on any particular assignment, then it would be okay for them to have makeup work, especially when they've missed, assignments from absences. And these are, of course, legitimate absences, which again, it's important to be communicating with the therapist, with the family, to really understand what is happening with the child. Students with reading compulsions or anxiety, these are kids who will read over and over and over again because they feel like they haven't absorbed fully what they've read. You want to encourage the student to read only once through, and I know this sounds a lot easier said than done. So one of the things that we do is that we usually ask kids who have reading compulsions to use an index card. And what you want them to do is cover up the part that they have already read. So the index card will be on top of the page. And as they're reading, they will cover up the line that they have read. And they cannot go back. They cannot remove that index card to read back what they've read. You want to also break down assignments into shorter increments and then allow them to summarize the shorter sections so that they feel that they have absorbed that section rather than going through 50 pages and asking them to repeat what they've read from that 50 pages. Reading material that is tape recorded or books on tape could be very helpful also for kids with reading compulsions. Then there are students with writing compulsions, and these are kids who are writing again and erasing and writing again and erasing. Sometimes it could be due to perfectionism, and perfectionism can take many different forms. It could be perfectionism in their own handwriting. It could be perfectionism in the syntax of their sentences, of their sentence structure. Whatever it is, it's really important, again, to encourage kids to write once through. And when you are doing that, sometimes kids who have sloppy handwriting, it's really important to not deduct their grades based on sloppy handwriting, because at the end of the day, you're not grading them on their handwriting. You're grading them on the context of their writing. Sometimes if kids have difficulties taking lectures or writing notes based on lectures because of their writing compulsions, you might want to allow them to record their lessons on a tape recorder, or photocopy your notes, or allow them to take photocopy notes from another student, or even provide them an outline of your lesson notes, of the teacher's lesson notes. One other thing that you can do is have somebody else there scribe for them as they are dictating answers when they are taking exams, taking tests. And then also with these kids, a lot of times it might be easier for them to type their responses, to type their notes. And when that is the case, it would be allowed for them to bring in their laptops to type up their notes or their assignments, or to take their tests typed. Now, sometimes a kid with significant anxiety, it can be unsettling to be in a classroom that is unstructured or that's full of uncertainty. So it's really important that the classroom, school environment is conducive for learning for a child with anxiety, which means that it's best to provide a calm, supportive, structured classroom. Some other things that you might want to do is to seat the student with anxiety away from other rambunctious classmates to decrease distractions. Allow the students to sit in an area where breaks can be taken easily without other kids noticing them, so allowing them to sit close to the door so that they can escape easily when they need to. You want to, again, and I know I've repeated this several times, it's to minimize classroom competition between the students, because that, especially for a kid with perfectionism, would raise a lot of anxiety. And you can help them create ties with other kids, for kids with social anxiety, by forming small groups with shared activities. So sometimes what I ask teachers to do is use the counting off technique, which doesn't allow kids to choose who they want in their own group. And, you know, we use this for kids with social performance anxiety to encourage them to be able to interact with other students in the classroom. So using the counting off technique to allow the student to be involved in a group setting where the kids may not be familiar with each other. You can also pair that anxious child with social and performance anxiety with another buddy, and this will allow them to have a support system right there. And of course, always assign a point person. So whether it's the school counselor or the school nurse, the school psychologist, where the student can check in with whenever they're experiencing anxiety, you know, where they can go to take deep breaths, to settle down before they return to class. Now, sometimes you're going to have kids who might need an IEP. This is the Individualized Education Plan. And in order for you might want to request this with the schools, and some kids with anxiety would be also eligible under the Section 504 plan, which are for individuals with a handicap. At the very least, if you do have a student with severe persistent anxiety, I think the most important thing is to refer the kid for psychological evaluation or psychoeducational testing, so that you can determine, or the educational or the assessment can determine what are the weaknesses that the child has and what are the strengths, and how can we promote, facilitate, foster the strength while we build up on the weaknesses, strengthen up the weaknesses. And that's what you would usually gather from a psychological evaluation.
Jenny, let me interrupt you.
Yes,
timing.
I think we're done.
I was going to say we have about 10 minutes.
Okay.
And we have a question from someone whose son was diagnosed with GAD a few years ago and did get better with treatment. But she asks, why is he now having thoughts of hitting or hurting someone, which is also giving him a great deal of anxiety? And he's not violent. He's well-behaved. And he's well-behaved at home and at school. Do you have any information about that or anything to impart?
Sure. You know, the thing about anxiety is that they're kind of like weeds that grow on a lawn. You know, anxiety has core roots that sometimes are very stationary or very stable. And sometimes treatment only addresses the surface symptoms and doesn't get down to the root fears. And when that happens, some of the root fears will stem in other ways. So perhaps for this child, it could stem in these aggressive themes. Now, the question that I would have is, whether the kid actually want to act on these aggressive symptoms. If the kid doesn't want to act on these aggressive symptoms, and in fact, these symptoms, these thoughts are intrusive, that's pointing me towards obsessive compulsive disorder. Because a lot of times, people with obsessive compulsive disorder have thoughts that they don't want. It's not like these are thoughts that they enjoy having, or it's not like these are thoughts that they will actually act upon. These are just intrusive, unwanted thoughts, and it's actually raises anxiety because it is so disturbing. So what might be happening is that this kid could have been initially misdiagnosed, and because of that, they only addressed surface symptoms, or this kid has now developed obsessive-compulsive disorder, which would warrant further treatment to address these intrusive thoughts themselves.
Okay. Let's see. We have another question coming in. Do you have any special schools that you recommend in the Maryland area? That might be a little too specific out of your range, especially since I say Dr. Yip is in California. This person has a student with school refusal from social anxiety, and it's putting the student at risk of not graduating. If you can't answer that at the moment, Jenny, maybe you could think about that and email me or
I think the most important thing, because I know schools in the Los Angeles area. However, a lot of educational specialists, so people who do psychoeducational testing, who do psychological evaluations. These are the people who will be more familiar with schools that might be appropriate for the child. Again, it's important to consult with a professional in the area who would be more informed about that. So what I would do actually is go on the ADAA website and look for a therapist in your area and contact a couple of therapists, interview them, and see what they have to say in terms of whether they even do psychological evaluations specifically for anxiety disorders, and what their thoughts are about schools in the area.
That's great. Yes. And I think that can be the answer to the next question. What kind of treatment is good for OCD? I know CBT, cognitive behavioral therapy.
Yes.
Anything else?
Well, when it comes to obsessive-compulsive disorder, you have to understand that CBT is the broad umbrella, okay? So it's the broad umbrella under which there are many different types of therapies that go underneath CBT. For obsessive-compulsive disorder, you want to make sure that your child also gets ERP, which is exposure and response prevention therapy, which teaches the child how to confront their fears without engaging in the ritualistic or compulsive behaviors. So CBT is not enough. You have to make sure specifically that ERP, exposure and response prevention, is a component of treatment.
Good. We have another question about what about for kids with separation anxiety?
What about kids with separation?
Yeah, what about them? It's a big question. Yeah, treatment-wise.
Right. Okay. So I guess in a nutshell, exposure therapy in general teaches you how to confront your fears. With a child with separation anxiety, what the child has to learn is how to separate and experience that discomfort without escaping, and over time feeling comfortable separating. And that is what exposure therapy is. Of course, it's really important to understand that exposure therapy doesn't mean that we're just going to throw you into the lion's cage before you're ready to tame the lion. Exposure therapy occurs in a very hierarchical manner, meaning that we are going to address the easiest fears first, okay, before we target the most difficult fears. So in this instance, for a child with separation anxiety, what I would do is I might have the child think about separating from the parents first. And then I might have the parent step outside of the door for 5 minutes. Or sometimes a kid cannot even tolerate that. So I might have the parent step outside the door for 1 minute and come back in. And then step to the end of the walkway for a minute before coming back in. And then perhaps going and taking a walk around the block before coming back. So as you can imagine, it is in a very hierarchical manner. It's a stepwise manner, so that by the time we are able to completely separate, which could be sending the kid to school, the child will be ready to tolerate that situation.
Okay. We have a whole lot of questions, so
okay, not a lot of time.
And a few minutes, right.
Okay.
This one relates to psychological evaluations. How often should a psychological evaluation be repeated in children, and would a thorough evaluation in a 6-year-old be valid 5 years later?
There is a 6-year-old is going to be so different developmentally, cognitively, emotionally than an 11-year-old. So if you had a child do a full evaluation at 6-year-old, by 11-year-old, I'm hoping, and again, the goal of doing an evaluation is to determine what are the strengths and weaknesses, and hopefully with your treatment provider is continuing to foster the strengths, however, strengthening the weaknesses, right? So hopefully in 5 years later, your evaluation is going to look different. And because of that, a child where the evaluation is 5 years later is definitely not going to be valid. 5 years is just too much time for change to occur.
Yeah, is there any protocol about, or is it so individualized that for a specific kid it would be 6 months, 1 year, 2 years?
I would say, definitely 2 years would be, the break point that I would suggest another evaluation. And again, it really depends on the developmental level and what is the problem that we're looking at. Okay. So depending on what the problem is, that will also determine how often you need to do a psychological evaluation. Sometimes a kid will only need one evaluation, right? And you have one evaluation to determine what those strengths and weaknesses are. The professional addresses what they are, and now the child is functioning, fully functioning. Then what's the need of doing another evaluation? I assume the reason why you're asking this is because there's still something wrong. And therefore, if there is still something wrong, it hasn't been addressed in 5 years, it would be important to do a reevaluation.
Okay, I think we have one more. We have time for a very quick question. I don't know if you can do this quickly. How do you get a teen to participate in therapy when they're unwilling?
When you say a teen, I assume you mean between
a teenager, yeah.
Oh, a teenager.
Teenager,
okay.
Sorry.
That is no easy question.
I don't think we can answer that in the time that we have left, which is about 30 seconds.
What we usually do here is we do a lot of motivational questioning, is that we really want the teenager to focus on what is it that they want in life. And obviously where they are now is not going to help them get to where they want to be. And if a lot of kids, they feel very stigmatized, and therefore they fear admitting that there's a problem or going to see someone about a problem because it just means that they actually have a problem. However, I think, and this is where awareness is so important, if kids understand that there are as many as 1 in 4 kids with a diagnosable anxiety disorder, that's a lot of kids out there.
Okay,
so
I'm going to have to stop you. So yeah, that's good. That is a big question and with a big answer. We've run out of time, unfortunately. So I am going to thank you, Dr. Yip, for presenting this, and
thank you, Jane.
We really appreciate it. And I'm sorry again that we couldn't get to all the questions. Everybody who attended and those who requested the logins will receive an email when I post the recording of this very webinar on the ADAA website, and that's www.adaa.org. And I'm going to thank everyone for attending, and good night.